coming to you from Clutisville in Stellenbosch, where World TB Day is commemorated, with a hall full of people who will get tested. They will get the opportunity to get tested, and then also there's a program that's being run with Gift of the Givers, because nutrition is crucial in the fight against TB when a person is on medication. So Gift of the Givers has committed to support this clinic in particular with food hampers for people who receive TB treatment for the next year. But to speak to us about TB in general, we have Dr. Tabitha Matose. She's from the Stellenbosch sub-district of the Western Cape Department of Health, and she's in family medicine and primary care. And we're going to chat to her now to find out about TB in general. Thank you very much for your time, Dr. Matose. Speak to us about TB. Why is it still such a prevalent disease in 2025?
Okay, so TB is one of the leading causes of morbidity and mortality. So when we speak about morbidity and mortality, we speak about the effects of disease, the adverse effects of disease, and mortality is the number of deaths that it causes in the country. So it is consistently among the top 10 leading causes of death. And with TB, it varies from country to country and from province to province. But the Western Cape consistently has had one of the highest prevalences of TB in the country over the past few years.
Why do you think that is?
So a big problem with TB is that once it is in the community, as we know, it is defined as a communicable disease, which means that it can be spread within the community. So a big challenge with TB is that the course of treatment is 6 months, and a lot of people don't adhere to the treatment for the full 6 months. Unfortunately, when they stop taking the treatment, they are still infectious. They may feel better, but they can still spread the disease. So as we know, it is spread through many different ways. One of them is by coughing, or what we call the droplet infection. So a lot of people that get TB are still young, economically active economically active, so they interact with a lot of people, either at home, either in the social setting, or in their places of work. So we find that a lot of people also come to the Western Cape to find work. So when they work and they are infected with TB and they go back to work before completing treatment, then they actually infect other people that they are around.
We also heard from a sister that's part of the clinic here, is that many people don't know that they have TB, and it's only through contact tracing that you find those people. Why do you think it is that people don't come forward to get tested?
So a lot of people actually think that they can't get TB, or they think that they are immune to TB because they say they don't smoke, or they don't know anyone that has had TB. But the thing is, not everyone that has had TB will disclose to their close contacts that they are on TB treatment. So we have people that are actually asymptomatic. They don't have any symptoms, but they are still infectious. This is why every time you come to the clinic, then you are screened for TB, which means first we ask if you have any symptoms or if you have been in contact. And what we are doing now lately is that even if you screen negative, but you can submit a sputum sample, we still test you for TB. And some studies have actually found that positivity rate can be up to 20%. So you can have 100 people that don't have any symptoms, and you just take sputum from those people randomly, and about 20 of them will have a positive TB test.